Hi, my name is Melisa Eraslan, and I'm a medical student at the University of Ottawa. Health is a fundamental right, and in medicine we learn that it's our duty to support informed health decisions. Yet many choices are shaped upstream by AI, social influence, and fast-spreading misinformation, while public health, bound by ethics and evidence, moves slower. If autonomy is being quietly engineered upstream, how should we rethink informed consent and ethical responsibilities? And is it realistic to expect trust-bound institutions to compete in an environment optimized for speed and outrage?
Who would like to jump in first? Great question.
I mean, I probably only understood 10% of that question, so I apologize. I'm the masochist here who decided to start a news organization during this weird and crazy time. As I said off the top, I'm incredibly optimistic, and I see it in our metrics. I should say, every news organization I've ever worked for, the stories that generate the most interest, the most engagement, the most subscriptions, the most registers, whatever revenue stream or metric you want to account for, the stories that tend to rise to the top are the stories that are the deepest, the richest, the ones that take the most time, and the ones that people really can dive their teeth into. That hasn't changed. So I'm actually incredibly optimistic that people will still want that. Is it a smaller amount of people relative to what else is out there? Yes. We need to do a better job, again, on media literacy, of educating people to take control of their own feeds. It's not that complicated. People need to first be aware, and it sounds from David's research that they are becoming more aware, that they need to take back control over their own feeds, and then choose their own sources. And look, I will say to everybody here, of course, my plug is read The Logic. It's the best news outlet in the world. But pick your sources, pick who you trust, and build a feed that makes sense. And I think we need to do a lot of education to push back on this. But what is the old saying? A lie can travel 7 times around the world before it can be corrected, I believe. So it is.
That feels like misinformation. Like, I've never seen it proven. No, I'm just kidding. It's probably true.
Love sitting next to you.
Dr. Gunter?
Yeah, I just wanted to add something to that. I mean, because it was a really great question and brings up this concept of what really is informed consent. Yes. And if you think about somebody coming in and they're saying that they don't want to be vaccinated and that they've read all the information, and you try to explain to them, that the correct information, and they decide to not have the vaccine, we would call that informed consent, but it's not, because they were preloaded with disinformation. And this becomes a really, difficult thing in the office. People come in, they want a surgical procedure, or they want to take a medication they've heard about online. They want to take ivermectin for cancer. They want to take rapamycin because they heard a longevity expert talk about it. And they're so sure that they're correct, then is the discussion you're really having informed consent? And my answer would be it's probably not, because they haven't actually had access to all the information. And I think this is something we actually have to figure out how we're going to teach in medical schools, and how do we know when the metric of informed consent has been met. And I don't think I have the answer to it. I mean, we can document all we want. Patient says they understood, but it opens up, how do you really know if somebody's truly informed based on what they came in preloaded with?
Yeah, and you're making me think of upstream privacy laws too, right? And expectations and sharing data and information, and also what people are getting themselves into. I don't think anyone wants to casually chat again with a computer system about their mental health and then get an ad for something, right? We're still reconciling with this, but then there's this other element where people seem to understand that the advertising economy is so synonymous with our online and kind of e-commerce experiences. So zooming out, I think, again, information ecosystems, epistemic sovereignty, freedom of thought, right? Freedom to get great information and not kind of have the information ecosystem contorted and manipulated is the fight for us now in Canada.
And we haven't even talked about health apps.
And we haven't.
And all the detailed information people are putting out there, and how is that information being bought and sold and transmitted.
We'll save that for our next discussion, because I have to conclude it there. Thanks, everybody. Appreciate you very much listening.